Thank you, Jen, for that warm welcome. I'm so excited to be at the Iowa Aging Summit. Before we begin, I want to acknowledge that we as a country have been having a pretty rough time of it. We're being asked to return to normal when for many of us, that doesn't even work, that doesn't even exist. We're living in a new normal. We're living and we're dying in at least two pandemics, COVID-19 and racism. I'd like to offer a moment of silence to allow us to remember and honor those that we may have lost and those who are no longer with us. Thank you. Next slide, please. So I was excited to see that Iowa is really a progressive state. In this 2019 data from the Williams Institute, UCLA School of Law asked respondents about how do they personally identify as lesbian, gay, bisexual, and transgender. As you can see, 44% are male, 56% are female, 80% are white, and 20% are all other races, but you all probably knew that. The average age of LGBTQ folks is 38, with a 6% are unemployed, 7% uninsured. 22% have food insecurity, and 26% have incomes below 26%. The number of LGBTQ SGL people per capita in Iowa is 3.7, or 39th state in the country. My hometown, Washington, D.C., is ranked number 1 and has the highest number of LGBT people per capita at 9.8%. Old age ain't no place for sissies, and that's been attributed to Miss Betty Davis. I just love her, right? And she wasn't necessarily talking about LGBTQ SGL people. I also want to stress that it's hard to be old and gay at the same time. Many old LGBTQ SGL people are finding it insurmountable and are going back into the closet. I am a witness. At 60 plus, I have to speak louder and firmer to reclaim my time. These times of COVID-19 make it definitely worrisome. And I don't want to be in a position that a 30-year-old and me both require that one ventilator that's left in the ICU. The decision makers may think I've already led a full life. I'll speak more on this later. The ageism and disregard for old people is real. Did you know that President Dwight D. Eisenhower's Executive Order 10450, issued in 1953, charged the heads of federal agencies, the Civil Service Commission, and the FBI with investigating federal employees to determine whether they pose security risks? And these are people who pose security risks. They're criminal, infamous, dishonest, immoral, or notoriously disgraceful conduct, habitual use of intoxicants to access, drug addiction, or sexual perversion. Executive 13807 was signed by Bill Clinton in '98 to prohibit discrimination based on sexual orientation in the competitive service of the federal civilian workforce. Now, this has not been that long ago. However, in my lifetime and after Stonewall and in Washington, D.C., many lives were ruined because of one's gender identity and sexual orientation. And we won't even mention race or ethnicity. DuPont Circle in Washington, D.C. was an area wherein gay folks could meet each other. However, if picked up in a police raid, their arrests would be in the newspapers, right out there in the Washington Post. So if you were a teacher, a lawyer, a student, you could lose your job, your resident, your scholarship, your children, and even your life. Can you imagine? Here's a clip of gay Black elders identifying issues that I shared at a Senate hearing re LGBTQ elders called by Senator Bob Casey, the ranking member of the Special Committee on Aging.
I grew up in Durham, North Carolina, and I remember white water fountains. I remember riding in the back of the bus. I remember having to go into restaurants by the back door. or if you went to a movie, you had to sit in the uppermost balcony.
I grew up with a family that was very involved in civil rights in Richmond, Virginia. We, at one point, moved into basically an all-white neighborhood, and we were greeted with a cross burning in our yard. I've gone through a number of things I never thought would happen, like a black president in our era, a black president that embraced, evolved enough to embrace the LGBTQ issue. And so many of our friends think we have arrived because of marriage equity. Trust me, we have not. We used to have a motto, as proud of our gayness as we are of our blackness. And the reason we had that motto is because the white folks were saying you have to focus only on LGBT issues. People of color can't afford that. You better focus on, so we're supposed to deal with multiple issues. And we've never had that focus because we've known that racism, sexism, ageism is right up there with homophobia.
AARP research entitled Maintaining Dignity found that over 75% of LGBTQ people were concerned about having adequate family or social support to rely on as they age. Its data revealed that 46% of gay men 45 years of age and older live alone. LGBTQ elders are also likely to have adult children to look out for them, in part because of deliberately designed systems created to prevent LGBTQ people from forming legally recognized families or adopting children. One of the people in my research, and now my friend, laments that he does not have any friends who are peers. He grieves about his loss of over 100 friends that he lost to the AIDS, HIV epidemic. He, like many other LGBTQ SGL elders, live alone with no biological family. Familial support of elders and caregiving often falls to the adult children. However, for many elders, LGBT elders in particular, this is not the case. Many have created what I call a logical family, a family to stand with them or stand in for the biological family. This was particularly true in the gay male population during the AIDS epidemic, like in my friend's experience, so many lives were lost. The future is somewhat brighter. There are several laws in the books that allow adoptions, acknowledge logical families should be informed, laws that allow whomever a person designates as his or her or their power of attorney, healthcare and property stands, whether it's biological family or not. And more happy news, there are many children and adults who are being raised or were raised by gay parents. These children will grow up and hopefully care for their aging gay parents, like children have been doing for such a long time. I know as the oldest daughter, I care for my dad and my stepmother after his death. I expect my son and my 3 grandboys to carry on that tradition. LGBT elders have lived most of their lives knowing that they could be put in jail or a mental institution just for being gay. One such story is told by an elder of the silent generation. I was 21 and just sitting at the bar watching women dance. Apparently, one of the women was a plainclothes officer. We were all taken to jail and had to appear before the judge the next day. My arrest record cites my being known in a known homosexual hangout. People could lose their jobs, their friends, their housing, their family, and more if their sexual orientation or gender identity were revealed. My friend, author, and baby boomer Minnie Bruce Pratt writes, in 1975, I lost custody of my 2 sons, then 7 and 6 years old. When I came out as a lesbian in Fayetteville, North Carolina, the sodomy statute, the crime against nature, was the law that the state and my husband used to take my children away from me. By the way, this picture is a picture of the movie Gen Silent. If you have not seen it, please take a minute to see it. We know that as LGBT SGL people, we're not monolithic. We have multiple layers of identities and members of more than one community at the same time, simultaneously experiencing oppression and privilege. We can face multiple oppressions, or we can experience a range of issues through the erosion of public benefits and the dismantling of welfare, the lack of affordable housing, the increase of homelessness, employment discrimination, immigration restrictions and raids, labor issues and workers' rights, incarceration and involvement with the criminal justice system, and environmental racism. As I noted earlier, LGBTQ SGL elders can be particularly marginalized and vulnerable within the LGBTQ SGL community and the broader society. My research on barriers to care to African American gay males and lesbian females found that they can experience a sense of grief and discrimination around the intersectionality of aging, being African American, and being gay. So the need for affordable, welcoming housing for elders, LGBTQ elders in particular. We're living longer. In 1985, older adults accounted for about 11% of the US population. By 2010, there were 13%, and more than 40 million Americans are now 65 plus. By 2030, as last baby boomer turned 65, older adults are expected to reach 20% of the population. After that, the population is supposed to level off, but that's still a lot of people. Living to 85. In 1900, only 100,000 Americans lived to be 85. By 2010, that number had grown to 5.5 million people living to be 85. This is the fastest growing age group of elders. By 2050, the 85 plus age group will reach 19 million people. 24% of older adults and 5% of the total population. Some researchers say this 85 plus group will grow even faster than this because the death rates at older ages are declining. We're living longer. And this is one of the predictions from the US Census. Despite this progress, LGBT individuals continue to be denied equal opportunity in housing. When surveyed, LGBTQ seniors regularly list housing discrimination as was one of their primary concerns, including trepidation about mainstream senior housing options, disparities in income, fewer familial resources for older LGBT adults, coupled with the increased demand for senior housing generally, create an environment ripe for housing discrimination against LGBT seniors across the country. And making matters worse, federal law does not expressly prohibit discrimination based on sexual orientation or gender identity, although some states and local jurisdictions do provide a patchwork of protections. As you can see, the state of Iowa has laws against discrimination in housing. This relationship between housing and other aspects of everyday life is particularly important for older individuals who may be more limited in their mobility, as well as rely on a fixed income. Imagine this. Imagine Mary's house for older adults. My childhood home becoming a welcoming residence for lesbians, gays, bisexual, transgender, and same gender loving individuals. As was mentioned earlier, I'm the founder and CEO of Mary's House for Older Adults. It's an organization to create welcoming environments, including brick and mortar structures for older adults, LGBTQ SGL elders in particular. We work to eliminate the intense isolation experience due to aging, subtle and not so subtle discrimination and intolerance based on one's sexual orientation or gender identity. Our first communal residence will be completed, brick and mortar residence will be completed in 2021 is our hope, fingers crossed. and it will provide quality communal independent living experience for adults 62 years of age and older. So this is what we will have. Plans to include 15 studios, laundry, library, computer, fitness rooms, and stonewall vegetable garden and flower garden on the roof. Think Golden Girls with Frankie and Grace, an aging RuPaul, Billy Porter, Wanda Sykes, Elton John, Robin Roberts, George Takei, Laverne Cox. I mean, it's not that we only want celebrities, but that would be helpful. So we're at a pandemic, and this is what Merriam-Webster, the definition of a pandemic. David Johns of the National Black Justice Organization and Earl Fox of the National Center for Black Equity wrote on COVID-19 and LGBTQ people. They write, the limited data that we have on LGBTQ community offers a disturbing snapshot of the impact on COVID-19's pandemic on our community. For one, there's the economic toll. 2 in 5 LGBTQ people work in the 5 industries most impacted by the pandemic: food service, hospitals, education, colleges, and retail, compared to just 1 in 5 non-LGBTQ people. And according to a survey from the Human Rights Campaign, all told, more than 5 million LGBTQ workers in these industries could be significantly impacted by the pandemic. The numbers are even worse for people of color, and we've heard this. Among this group, 38% have had their work hours reduced compared to 34% of the general population, according to HRC. 22% have become unemployed during the pandemic versus 13% of the general population. These job losses are even more dangerous in light of how many LGBTQ people already had lived in poverty before COVID-19 struck. One 2019 analysis from the Williams Institute found that 22% of LGBTQ adults, including an alarming 29% of transgender adults, live in poverty, compared to 16% of their straight and cisgender peers. The police killing of George Floyd by bystanders watch showed us how our country struggles with racism. But structural racism is not exclusive to the US. Like the COVID-19 pandemic we're currently facing, racism is present in every nook and corner of this planet. His tragic death has sparked worldwide protests against racism and police violence. These protests have moved US lawmakers to introduce a bill to end excessive force used by the police. We must work together in combating COVID-19, and we must eliminate racism globally. The COVID-19 pandemic has exposed long-standing economic and racial inequalities. According to the Centers for Disease Control and Prevention, Black and Native American people are 5 times as likely to be hospitalized with COVID-19 as white people, and the hospitalization rate for Latinx people is 4 times the rate as for their white counterparts. This may be in part because those deemed essential workers are disproportionately people of color, putting them at greater risk for the virus. Dr. Jean Axius, Senior Vice President of Thought Leadership, states that communities of color shouldn't be living shorter lives than their counterparts just a few blocks away, and no one should be dying of hunger, experiencing homelessness, poor health, and a speedier death as a result of loneliness as an older American. The risk of serious illness and death is highest for people living in nursing homes and other congregate settings where over 40% of the COVID-19 deaths have occurred. As states face massive budget shortfalls, they will first cut optional services, including Medicaid, home, and community-based services, which are necessary to keep older adults and people with disabilities out of institutions. And finally, severe social isolation. I talk about this a lot, which was already a tremendous challenge for older LGBT people, has increased by multiples as a result of COVID-19, pandemic's shelter-in-place rules, and the quarantine rules, and the reality that many LGBTQ SGL older people have literally nobody to reach out to for connection and support. Even before the pandemic, studies showed that LGBTQ SGL older people are already twice as likely as their straight counterparts to live alone. This just shows us how COVID-19 is quietly ravaging the LGBTQ community. Help, I've fallen, I can't get up. That was amazing to me. That been the US economy, and then we have folks in government saying, thank you for your service. That since you're old, thank you for your service. During this challenging time, people with the fewest economic resources are particularly vulnerable as the safety nets they've relied on have now been lost, and they need because of loss of jobs, and they need assistance. But for me, the more egregious sentiment and lack of respect of elders came from the president. He said, we're going to have to let some people die so the stock market can live. And then Texas Lieutenant Governor Dan Patrick, his opinion of old people, said, well, no one reached out to me instead as a senior citizen. Are you willing to take a chance on your survival in exchange for keeping the America that all America loves for your children and grandchildren? But if they had, it's an easy exchange. I'm all in. I just think that's I just think that is egregious. Dr. Schulman, who's the president of the APA, said, we are living in a racism pandemic. She states that racism is both a direct and indirect cause of mental and physical health disparities. And its impacts are not due only from overt racism, but for the deep structural and systemic racism and daily microaggressions. We cannot talk about well-being without addressing Black Lives Matter. Black people have not only watched their friends and families die at higher rates from the coronavirus, they have also watched people who look like them being gunned down while going for a jog, be murdered in their homes, be threatened while bird watching, and mercilessly choked on camera. And this is what truly resonated with me from Danielle Cadet's blog. She wrote, every day we Black people have woken up and answered the emails and gotten on the Zoom calls. We've showed up with a smile and put the pain and the fear behind us. We've swallowed the rage while responding to our bosses and offered the assistance and worked twice as hard for half as much because it's all we know how to do. But here's a news flash for all the white people unaware of this fact. Your Black colleagues may seem okay right now, but chances are they're not, and you shouldn't be either. What's ours to do? We can create aging communities and social service environments that are visibly welcoming and inclusive. We can continue to develop programs that specifically address the needs of lesbian, gay, bisexual, transgender, queer, and same gender loving people, and particularly LGBTQ, SGL people of color. We can invest in diversity and inclusion training. We can produce material that celebrate the lives of older LGBTQ, SGL elders, and we can dismantle institutional levels of racism, ageism, heterosexism, classism through policy, marketing, and staffing. What's ours to do? I'll give you a chance just to read it for yourselves. In a racist society, it is not enough to be non-racist. We must be anti-racist. Thank you very much for your time.